My community also has experienced racism for generations in Ireland and still have a negative impact on our daily lives. Has there been enough conversation, do you think, at a national level or international level regarding the needs of ethnic minorities? Should racism be declared a public health issue, do you think?
Well, racism is a poison in all societies. We see it in so many aspects of daily life. It has so many different manifestations. And clearly, one of those manifestations, one of the outcomes of systematic racism is unfair access to healthcare, marginalization, othering of people to a point where they don't get access to education, they don't get access to healthcare. So ultimately, yes, there is a health consequence to racism, a direct psychological consequence, a denial of service consequence, a marginalization consequence, a poverty consequence, an education consequence, and all of those lead to ill health. So yes, racism is a health issue. And we say in WHO we have a fundamental right to health, social, mental, and physical health. And that is written into the WHO Constitution, that every human being has a fundamental right to that health. So racism is a barrier to that health. So racism is a health issue. It is absolutely a health issue. The Irish people in general don't need to be told about racism. Irish people have experienced it for generations and for centuries. But is unacceptable then as a community that we would then expose people within our communities to the very thing we as a country and as a people have suffered for many centuries in many circumstances. And that to me is, if the measure of any society is how you treat not the people who are the same as you, but how you treat people who are not the same as you, for whatever reason, religiously, ethnically, from a racial perspective, from a language perspective. There are so many different economic perspectives, right? So it's very easy to be tolerant of people who are the same as you or you perceive as the same as you. The real test of our humanity is not that. The real test of our humanity is our tolerance and our inclusion. And clearly, I would definitely agree with you that ethnicity, it inherently is associated with poor outcomes in health. There are some reasons why different ethnic groups may experience different diseases in different ways. There are genetic reasons underlying, but the vast majority of the reason why people in certain ethnic groups have poor health outcomes is to do with the social inequalities, it's to do with exclusion, and it is not to do with their genetics, and it's not to do with their underlying humanity. It is to do with the social circumstances in which they live. It is to do with the access to healthcare they have. It's to do with their education, their wealth, and it's to do with the degree to which the society within which they live accepts them as equal to others. And we still have huge issues. We still have modern day slavery, indentured labor, systematic racism. It's not gone away. In fact, if anything, it's getting worse and becoming more acceptable and more tolerated. And something that we as a global community, I'm a global citizen, proud Irish national, but it's something that I myself, when I think of my country and I think of all the wonderful things that I feel proud about, the things I'll feel less proud about are sometimes when I see images of racism, images of exclusion that come from Ireland at times. Yeah. I think we're better than that. And I think we are a small country who should be open, tolerant, inclusive, because our society is stronger and better for that. Not because it's the nice thing or the right thing. It's just the smart thing for us to be. An open, inclusive, tolerant, outward-looking society that sees the value in every person. I mean, I work in the World Health Organization and for the United Nations. and people criticize the United Nations, but I am really proud to wear my lanyard and to wear because it's the United Nations. It means something to me. That word has meaning to me. And I try to at least give my professional life for achieving that goal of uniting nations, of leaving no one behind, of always, and we talk here about being servants. We're not here to tell people what to do. We're not here to be paternalistic and to give, the gift of science and health to people. We're here to serve the most vulnerable people in the world. We're here to serve them. We're here to stand up for them, to speak for them, to give them a voice. That's our job. And we need to be really good at that, because there's a lot of forces that work against that. And that would be the same in Ireland. There's a lot of natural forces that work against equality and they work against inclusion. So we need our best people in all parts of society to work together to make sure that we demand inclusion, we demand tolerance, we demand equity in our society, because that's the society we want to be. That's the society we want the world to see, is an open, tolerant, and inclusive society in which everyone has a voice and in which everyone has equal access to healthcare, equal access to social care. I know it sounds like a pipe dream to you who live in a community that has been much marginalized, but I don't think it's impossible if those of us who give a damn actually want to go and make changes.